Hi, everyone, and welcome back to Health First. Today I'm here with Dr. Monica, who is an IV sedation dentist. Hi, how are you?
Hi, everyone. How is everyone doing? Um, I'm glad that everyone took the time to come here to check us out and see how this is going. So yeah, I'll let you go ahead and get started.
Thank you for joining me here today. I'd like to start by asking what influenced you to pursue a career in dentistry?
So growing up, I always knew I wanted to do something in art and science. And I actually shadowed my dentist when I was around maybe 10-ish or so. Just kind of got to take a look around the office and see what they were doing. It was always really intriguing to me. So for me, it started when I was really young. And I kind of just kept pursuing it as I got older. So I got into spaces where I exposed myself or was asking, hey, can I come to your office? Can I see what you guys are doing? Can you tell me a little bit more about that? Things like that. So for me, that's seeing a dentistry and what was going on with it and how dentists were able to help patients solve their problems immediately was really interesting to me. Medicine, I think, is a little bit different. You have to kind of figure out what's going on, and then you may be able to treat it. It may be one thing, maybe something else. But with dentistry, it's pretty much cut and dry almost. If a patient has a cavity, they need a filling. If the tooth is hurting, most of the time they need a root canal or an extraction. So for me, all of those things kind of led me down the path to say, okay, like I want to be a dentist. I loved healthcare. I wanted to help people. And I knew that dentistry was the avenue for me versus medicine, which they are similar, but different. So for me, that's what it was.
Yeah, and you're an IV sedation dentist. So why did you choose your specialty?
So IV sedation is actually not a specialty. You can be a dental anesthesiologist, which is different from what I am. I am a general dentist, and my area of practice is IV sedation. So I do general dentistry, I do implants, I do braces, I do wisdom teeth extractions, I do surgery, I do crowns, I do fillings. Occasionally, I will see a pediatric patient. But most of the patients that come to me are high fear, which is almost everyone in the adult population. So most patients have had bad experiences in the past, and they are like, oh, I hate the sound of the drill. I hate the sound or the feel of, the dentist drilling or the scraping or whatever. So I provide that opportunity for my patients to come in and be sedated for whatever their treatment needs are. A lot of patients who neglect their oral health, it's not because they don't have the means or they don't know what's important. A lot of the time, it's because of fear. So I kind of take that fear element out of it for patients and afford them the opportunity to come in with sedation for even just a deep cleaning, which is a lot because it's a lot of shots, as they call it. You have to numb the whole mouth or whatever the areas are that you need for to do the deep cleaning. And so it's a great area of dentistry. I do feel like, not that I'm a super general dentist, but kind of, because I can provide patients with everything that they need. Most patients, when they establish the rapport with their general dentist, they don't really want to see anyone else. So if you can do root canals, if you can do braces, if you can do wisdom teeth, all that's to your advantage because your patient really wants to stay with you once they like you and they trust you. And I think that's a big thing with dentistry. Patients, they don't really know what's happening. They can't really see. They're just trusting that you're going to do the right thing. So
Yeah, definitely. And what do you like most about your profession?
about my profession, I like the fact that I can help my patients to feel better about themselves, whether it's a smile makeover with veneers or crowns, or even just taking a tooth out that hurts them a lot, or just doing a deep cleaning or helping them gain that confidence of just smiling again. So it's actually very rewarding profession in my opinion, and even as far as just not even the patient side, but the staff side. When you have people that come into a profession where you can help people and you are helping people, you help them feel better about themselves, and then you feel good that you've done a good deed. You've made someone's life improve. You've helped them down a path of healthiness, of improved oral health and overall health, and just happiness overall. Lots of people don't smile because of challenges they have with their teeth. That's the first thing you see. Now, right now, everyone's wearing a mask, but it's really a really, really big thing. You know, the whiter your teeth are, or the healthier your teeth are, the younger you look. And honestly, the healthier you are, because most diseases start in the mouth, or the first detections of them are in the mouth. So
Definitely. And as you know, the COVID-19 pandemic has greatly affected the world and continues to do so. So how is it like working throughout the pandemic?
So for dentistry, it's not really a big change for us because we use universal precautions. We treat every patient as if the patient has a communicable disease that's bloodborne. You know, we sterilize all of our instruments. We always wear masks. We always wear gloves. We change them. Um, we don't cross-contaminate items. You know, we're very safe and clean. So the dental office is actually one of the safest places you can go. You know, a lot of concern was surrounding the aerosol from the handpiece that's air and water driven, or from the scaler, which is also air and water driven. And those particles being in the air, with COVID-19 being airborne in some aspect, that could be an issue. But every person in every dental office is wearing a mask, is wearing gloves. So you're actually very safe there. Now, for us, it could be an issue as healthcare providers, because we don't know what patients are vaccinated. We don't know what patient has COVID or does not have COVID or has been exposed to someone with COVID. So actually, as a healthcare provider, it's more of a risk for us than it is for our patient, because we are protecting ourselves and our patients from getting anything. It's been great to be open. My office, we never close because we do provide all dental services. So we have been able to provide patients with root canals or extractions when their dentist may have had to close, which has been great for patients and great for us too. But is it scary? Absolutely. So we have increased our PPE. We've increased, we wear face shields now, which we already did before for certain procedures that just have more air and water, projection, or if you would call it. So we're very safe. Every patient, every staff member is required to wear a mask all day long. Every patient that comes in our office is required to wear a mask when they're in any area where another patient is not. So pretty much only in the rooms is when we are having the patients take their mask off. We use suction devices that kind of keep the aerosol down from just getting into the air. So it hasn't affected my office much. We're still able to provide services for our patients. I'm grateful for that. And I'm happy that I can provide services to patients who still need access to healthcare during the pandemic.
Yeah, definitely. And I intern at a dental office, so I see how safe it is and how the spread is like contained very well.
Absolutely.
And to end off, can you give a few words of advice to people hoping to pursue a career in dentistry?
If you're pursuing a career in dentistry, I would say for sure, number one, you need to go in and shadow a dentist, see what it's like as a dental assistant, even, because as a dentist, you have not only the responsibilities of the dental assistant, but also the dentist too. So I think if you are interested in pursuing that, I for sure say you need to go in and shadow and see if this is something you want, like watch a procedure, watch an extraction, watch a crown prep, watch a deep cleaning. All those things are very important. I think we kind of glamorize it as a profession that you can make a lot of money and work only a few days a week, but you really have to want to be in that space to succeed at it. You want to be a good dentist, and honestly, dentists are people who should have good relationships with people. You should know how to communicate well with others. So I would say that's the first thing. The second thing is, if you are already matriculating through your career in dentistry, on your path to dentistry, I'd say what one of my professors told me, study hard and pray harder, because it's a lot. You are sacrificing a big portion of your life to dedicate yourself to education so that you can help people. I think it's very important. It's definitely a calling. So don't do it just for the money, because that you won't like it. And also set your goals, make a plan, and review those every few days. Put it somewhere in sight, like make a vision board. Those are the ways that you become successful. Habits that you repeat, those things are what make you successful. And you will always fail at something, but if you keep pushing yourself to do better, to change your habits, you will always be better than you were the day before. And that's the goal in life. Even with dentistry, when you become a dentist, even if you're the best dentist in the world, there's always something that you can improve on. There's always technology that's improving. So it is a lifelong commitment for sure. So knowing that, being dedicated to that personally, professionally, and just knowing that dentistry is the area that you want to go into.
Yeah, thank you so much for the great advice. And those are all the questions. So thank you for joining me, and thank you for your time.
Absolutely.